Greetings, everyone. Welcome to the Trans Files. I know last week we kind of took a little bit of a much needed break, actually. So, Tsukuru, I know you were out canvassing out in Washington to get some
Yes.
signatures. So, why don't we go ahead and just dive right in because we're going to be discussing healthcare. We're also going to be discussing about some hate crimes with the trans community. So, I'm going to go ahead and give you the floor, Tsukuru.
Yeah, thank you, thank you. So yeah, we were off last Tuesday. I mean, for a lot of reasons, but one of the reasons was, as Noah said, yeah, I was in Washington State. So, I live in California, right? LA, to be exact. But I am a part of Red Beret, and so is Noah. But so two things. So in the state of Washington right now, there is a ballot initiative for universal healthcare. That is to say, healthcare for everyone, absolutely everyone. No monthly premiums, no payment at the point of service. Includes medical, dental, vision, hearing. What I mean, everything, right? So yeah, and they're doing a ballot initiative. That is to say, giving us the people for the opportunity to vote. You know, for or against. Because people, I believe, have the right to vote and express their opinions about this issue. You know, because like as what happened in California, in the California state legislature, and the politicians, if you go legislative route, the politicians wouldn't vote for this because they don't want to expose themselves, because they I mean a lot of, most of them, especially in California, they talk about, oh yeah, we are for single payer, right? A lot of them do because we have a Democratic majority in the state legislature in California, and we have a Democratic governor too. Um, so they've been saying that they are for single payer, but this back in January, what happened in California was there was a bill in the legislature. They were minutes away from voting, and then the author of the bill pulled it. They essentially killed it. They didn't want to vote for it. So people in Washington State, smart people in Washington State, started this initiative so that they can vote for it. In the fashion of direct democracy. So
Mhm.
they need to collect 400,000 signatures by December 20th. So that is why in the spirit of solidarity, I went out to Washington State for a week, uh, collecting signatures every day. So yeah, no, it was great. It was great to do this with people, good and beautiful people of whole Washington. That's the organization that's promoting the initiative.
Mhm.
Um, so yeah, that felt good, and also like I got schooled. It was a very good learning experience to be out there, and talking with people who are for it and against it. Um, I got some shitty responses and very encouraging responses. But that was all interesting. But um, this okay. So this is one thing that I want to emphasize because especially on this show, because this show is by and for transgender and other members of LGBTQIA plus community. Um, so what I want to say, I will just say it in 2, 3 sentences. Yeah. So, guys, we have to be out there, um, you know, advocating for universal healthcare and single payer, or whatever you want to call it. Actually, whatever you want to call it, it's essentially, name really doesn't matter, but healthcare for everyone and the right to live for everyone. That's what it is, no matter what the name is. So we need to be out there advocating for that. We need to demand our seat at the table. We need to be included in the conversation. And I feel like, there's not enough representation uh, for us and by us. And that's actually two-way street, I feel like. Um, you know, uh, Maybe many orgs are not doing necessary outreach either, but it's easy enough for us to kind of assert ourselves, go out there and, demand to be included in the conversation. So, yeah.
You're 100% correct. I mean, it's just the whole thing. I actually want to kind of go into this, even with trans lives. Like, there was a trans life that was recently lost. Her name was Sherry Bush. Okay,
Mm.
she was homeless. Okay, and she was murdered just on the basis that she was a trans woman. HRC didn't even pick that up. I made a tweet about it. Now it's up there.
Oh, good. Yeah.
Coincidentally enough. But the recent one that I actually do want to discuss tonight, and actually I'm going to go ahead and bring this up. So give me a minute.
Thank you.
I'm way, okay. Okay. Let me pull this up and blow it up. So the recent death was Maricela Castro. She was 39 years old. She literally was just shy from her 40th birthday.
Mm.
She's from Honduras. She spent most of her life in North Carolina. She moved to Houston, Texas to be closer to her family. Give me just a minute. Sorry, I have dogs. I am so sorry about that.
Okay, dogs bark.
well,
You
just to be
you'll be
fair,
worried if they didn't. So yeah.
well, my dog. So Benji actually scared me last night. He was
Oh.
not breathing properly. He
Oh.
was twitching, and so I've been keeping him in here. Frenchie's in here, and she's just kind of being kind of like an entitled Karen right now. So I apologize. So now I have kicked him out. So hopefully now I will not have any interruptions. But anyways, I'm going to go ahead and just kind of restart on this, if you don't mind. Hopefully, we can edit this
Of
out
course.
later. So,
Right.
anyways, the recent victim, her name is Maricela Castro, 39 years old, shy from her 40th birthday. She is from Honduras. She immigrated here to North Carolina, moved to Houston, Texas, to be closer to her family. She worked in construction and she experienced discrimination just on the daily.
Mm.
The reason I'm mentioning this is because this is something that trans people go through on the daily. So her name was actually inspired by a Mexican American artist named Maricela. Her demeanor was bright and positive. There is a reason I'm bringing this, like this little background info sheet on her, is because she is a human being and she needs to be recognized as such. Everybody has a personality. Everybody has jobs. It's just she's got, okay, being trans enough is enough to get discriminated, but like she also has another cultural aspect to her, and there's already a stigma that's on top of that. That's why I feel it's important that everybody knows her story and her background.
Mm.
Let me go to this. So, trigger warning for any violence. She was fatally shot on July 29th, so that was a Friday. So the killer had driven her home, basically, and as she was walking out of her car, he got out of the car and decided to shoot her in the back. So the location of this was in the North Shore neighborhood of East Houston. The killer has not been caught. So the key point I was reading in that article was that her identity remained a mystery. Let's go into that. Do you want to know why that trans lives, that there's probably not a lot of trans lives that are being talked about right now? Is because we got a lot of people that are not even respecting trans people as human beings. They're misgendering them, and they're not even, they're not recognizing them for who they are. They're going it as, okay, well, you haven't changed anything yet, so let's go ahead and dead name you and like misgender you.
Mm.
So instead of like using HRC, I actually found a organization. They're based in Pittsburgh, Pennsylvania, and they're run by lesbians.
Mm.
I wanted to bring this up. They wrote about her.
Mm.
So they actually got in touch with her friend Jorge and
Mm.
quote, she had no enemies.
Mm.
He actually suspects that her death was the result of another senseless hate crime.
Yep.
A hate crime.
Mm.
She was always so happy, but you know that all across the US there are many that don't like transgender people, and this is not the first time this has happened.
Mm. Mm.
That last line got to me. That this is not the first time this has happened. It actually took me a long time to do this slide, to be honest, because this was hard for me.
Mm.
Let me
Yeah.
see if I get the. In addition, so here's a key takeaway. In addition, she is the fourth Latina trans woman and the 20th woman of color from these neighbors, respectively. Her
Mm.
death means a trans neighbor has been murdered every 8.4 days in 2022 in the United States. To date, the victims include 16 Black trans women, 4 Latinx trans women,
Mm.
1 AAIPI trans woman, 2 white trans women, and 2 white trans men. The youngest was 17, the oldest was 50, 10 were 25 or younger. Their deaths come on the heels of 2021 and the most violent year in recorded history, with the deaths of 57 trans, non binary, and gender non conforming people in the United States alone. Note
Mm.
that the tabulation includes a significant number of reports of folks murdered in 2021. The key takeaway, I apologize, that people need to remember, this is why we all need to be culturally humbled and kind of going to like, we need to have that seat at the table. That's what this includes. We all need to be culturally humbled. What does that look like? It means going out in the community and talking to others, getting their story, getting their point of view. And the thing that I really want people to pay attention to with the trans lives that have been lost, focusing on the challenges before they actually were murdered. A lot of the trans lives that I have personally have researched, let me go ahead and actually get out of this full screen. The thing that you got to remember, most of the trans lives that have been lost, they have struggled with the effects of capitalism.
Mm. Mm.
Not being able to get their hormones, having to basically go ask a friend. Like I've recently have had to deal with that. I ran
Mm.
out of my testosterone, so I actually hit up somebody that I knew, and he actually gave me his testosterone because I was out.
Mm.
I currently don't have health care. I can't even it's not that I can't transition. It's just like consistency is everything when you're actually doing hormones.
Right.
When you don't have that, I mean, it's not going to leave the person in a pretty place. Let me put you.
Right. Right.
And I actually want to go on the subject of healthcare, and I'm sorry. Like there's a reason I wanted to talk about Maricela. First of all, nobody should ever forget her name. First off,
Mm.
remember that day. Okay, this definitely could have been prevented.
Yeah.
But the reason I wanted to bring her up is because she experienced workplace discrimination. Okay,
Mm.
most of the time when we're trying to get access to healthcare is through our employer, right?
Mm.
This
Yep.
is why a lot of trans people have a challenge of actually fulfilling the like obligation to transition if they want to, like their own personal obligation to transition, getting on hormones, getting the surgeries.
Mm.
How can they maintain their health care when they're constantly getting discriminated against and getting let go because of who they are?
Yeah.
That's the key takeaway that I see from that. I mean, that's why like my job history has been kind of rough because I pretty much ever since I've been out here in California, I have dealt with so much discrimination. It's fucking ridiculous.
Mm.
So I actually want to bring this up. Actually, this is a I want to go ahead and kind of give everybody a chance to get educated real quick. So these are actually from research papers, psych research papers. Okay. So the trans community is not really like focused on with stats, and that's basically my problem when it comes to healthcare in general, is that the research isn't consistent. They don't do it like I personally think research needs to be done every year. I mean, if
Mm,
you really are like saying like, hey, we really need to focus on this stuff, you should be up to date with your research. That's why in some sense I like the Trevor Project, because they kind of keep up to date with their stats.
mm,
But the thing that we need to remember, in the United States alone, there's approximately over 1 million people who are transgender. Let that number sink in. I'm sure it's probably, I think the correct number was like 1.5 million.
mm, mm,
They are 4 times more than likely to be living in poverty
yeah.
compared to cisgender individuals. There's double rates of unemployment and double the rate of being homeless. 41% of respondents reported at least one suicide attempt. At the moment, there is no clear representation of the trans community due to the fact that there are many other diversities that identify as trans. That right there is the problem that's occurring, at least in healthcare. At least
Mm,
for my field, I can actually speak on that with mental health.
mm,
Because we've been saying that being trans is unique. Our stories are different.
yeah.
We shouldn't be put in a category. That is the problem right now. That is why the quality of healthcare is bad when it comes to trans people, because cis people don't really have a full understanding of us. They can't, like, in a sense, like, they can't really acknowledge the fact it's like we shouldn't be put in a category. But I actually want to take a pause on that, and I want to like turn the mic to you on this one, Tsukuru, with the stats that you're reading on the screen.
I guess what I want to say, I guess, is so yeah. So when I came out, or after I came out, um, I actually looked into these stats as well, right? Especially about the rate of poverty amongst trans people, because I was kind of interested. I was very interested in that. Um, well, I guess because ironically, the what should I say, like motivation or opportunity behind my coming out was the fact that I lost my career of 21 years, right? My company couldn't survive the COVID, and so we closed down the operation, and I really the difficulty behind my coming out, or the reason why I couldn't come out before, was that to protect my career, because um, I just wouldn't be able to continue with the company that I worked for, um, knowing that yeah, no. Anyway, I worked for sort of, I mean, American company, but owned by the Japanese male in his 70s, and I just couldn't imagine him being receptive of me being trans. So anyhow, so I lost my job and I came out, and I was interested in how, because I heard stories before, right? A lot of trans people end up on the street, and so I kind of had a vague idea or a general idea of hardships that we face as a community, but I wanted numbers. So I did look into these stats, and really shocked me when I saw you know trans people are more 4 times more likely uh, to live in poverty than cisgender people. But it's very real though, right? Because it's because a lot of us, just like Maricela, we face discrimination at workplace. I mean, really everywhere but workplace. So and it doesn't really have to be a blatant discrimination either. It may be okay, maybe this kind of I don't want to say this, but I'll just say, for lack of better words, it can be a little things. And when I say little things, what I mean by that is that uh, some things that you cannot legally prosecute. You
Mm-hmm.
know, it can't be. It can be, or most likely be, um, kind of like behaviors or something, some things your coworkers say, your coworkers say that really hurt your feelings, but if that persists, if it happens like every day, it can be very taxing. People
Mm-hmm.
may not realize that. People may think that, oh, it's just like, I mean, words don't kill you. Well, is that true? I
That.
do think that words can kill.
Oh
Or
yeah.
yeah, the comments you get, little, like, comments you get, if it's daily, it can be very, very damaging to your health. So
I
that's the
mean,
thing, though.
mm-hmm.
Yeah, go ahead, go ahead.
Well, I was gonna say, like, I mean, with my recent discrimination that I dealt with at Turning Point, like that hurt.
Yeah.
Like, because I'm in a field that is supposed to promote inclusivity. And, they're touting around about how they give a shit about the trans community and, how we need to be more inclusive. But yet, I didn't receive that.
Hmm.
So I said, like, healthcare, in a sense, like, my opinion with healthcare, it's like the reason why the quality of care is so fucked up, at least in mental health, is like the tedious requirements from insurance companies. They
Hmm.
put stress on the mental health workers. And on top of that, our field talks about how we need to practice self care. Then why is it not being reinforced in the actual field? And most of it is in community mental health agencies.
Hmm. Hmm.
It is the worst kind of performative allyship if I've ever seen it.
Yeah.
I mean, it's like this shit is fucking real. But like, I wanted to go ahead and bring something. Actually, bring a point here, and I'm sorry, my daughter's actually coming in the background. Um,
Hi,
so
Faith.
So actually, I will give them this. This little line here, actually, I know there's been in some improvements, but like when professionals are being trained, particularly with healthcare, like I remember, I this is the reason why I'm saying like it's kind of grown a little bit because when I first really essentially got into this field, they would actually say that being trans is part of a sexual orientation. They
Mm.
never treated it separately
Hmm.
from it. Granted, it's getting better now. It's become a little bit more separate, but I still think there needs to be an improvement.
Yeah.
But from this article, I'm going to go ahead and just review like what they said. On the basis of a limited number of sources in 2009, the APA estimated, which the APA is the American Psychiatric Association or Psychological Association, estimated the number of transgender individuals in the United States at 115,000 to 450,000, or 38 to 47 per 100,000, by using U.S. Census data for that year's total population size. The value of these numbers is limited, as the lower limit was based on members of a lesbian, gay, bisexual, and transgender website who identified as transgender, which is unlikely to be representative of the U.S. general population. And the upper limit was based on an older and part non probability sample of North Americans, 17 which may not reflect current members in the United States. More recent U.S. population based surveys have reported transgender population sizes that are higher, ranging from 153 to 1,647 per 100,000. 18. These estimates may not generalize to the United States as a whole, as they were based on data collected in Massachusetts. There's about 8 adults 19 and ninth to 12th graders in Boston public schools. 20, perhaps the best current estimate, is provided by Flores, which is another author, who estimated that zero point 0.6 of U.S. adults, approximately 560 per 100,000, identify as transgender. They use data from the Behavioral Risk Factors Surveillance System, which is administered annually to randomly select adults across the United States. This is basically how they've been saying, like, okay, well, these people are identified as transgender. I'm going to see what, hold on, I'm going to find my mouse. Oh my God, it's being insane. Okay, give me a second. Okay, there it is. So I know that graph is kind of hard to see, but this little table right here, if you can if you look really closely when it comes to gender identity, they basically have labeled it as sexual orientation. So the type of questions that were being asked in this study when it comes to gender identity, when it comes to understanding it, do you consider yourself to be transgender? Do you identify as transgender? Are you male, female, or transgender? And what is your gender? In addition to male or female gender options, responses and options included transgender. Which of the following best describes you? This was more when it came to addressing the sexual orientation. So it was like, which of the following best describes you? Which of the following best represents how you think of yourself? Do you consider yourself to be? Do you think yourself as? I'm sorry, I have an issue with this. I have a problem with this line of questioning. First of all. So, like, response options included transgender, transgendered, or you are transgender, transsexual, or gender variant. See, it's reinforcing that categorical factor. I'm sorry, I hate that shit. Like, but I want to go ahead and actually really break down the stats for you when it comes to the trans community, and this is why it's. I'm going to definitely make a point to like connect this with healthcare. So with demographics, okay, transgender adults that are under the age of 35, there is 44%. Then cisgender adults, 27%, with 1 in 4, 25% transgender adults under the age of 25, which, by the way, key point, data not shown. They didn't have a visual for this. At the other end of the age spectrum, 16% of transgender adults are 65 years old or older. I cannot talk tonight. Oh my God. Okay. I must be having the after effects of Monday, I swear. So this is actually, here's an actual better scale. Actually, I was able to find something. So this is the actual number: 27%, 44%, 33%, 26%. Education. Transgender adults reports fewer years of education compared to cisgender adults. Holding age constant. Analysis not shown. Nearly 1/4 of all transgender adults, 23%, have less than a high school education compared to the 13% of their cisgender peers. A smaller share of transgender than cisgender adults graduated from college or technical school, 15% versus 27%, respectively. God, I love those terms. Anyways, race, ethnicity. While a majority of transgender and cisgender adults are white, a larger share of transgender than cisgender adults are black, 16% versus 12%, respectively. Annual household income. See, that this is where it's going to really come down to at the end of the day. People do not talk about the ones that are lower income, and they are the ones that would actually everybody would benefit from a universal healthcare system, but it would really benefit the ones that really are in this little bracket, the under the 20,000, 20 to 35,000. Annual household income. A larger share of transgender than cisgender adults live on lower incomes. 25% of transgender adults report an annual household income under $20,000 compared to 15% of cisgender adults. Based on the income reported for 2017 and 18, which is this little figure right here, transgender adults are more than likely to report an annual income under 20,000 holding age constant. Analysis not shown. I really have no words, honestly, because like
Yeah.
It's just insane. But I know this really didn't show that much, but with the health status insurance coverage, basically transgender people are going to be more reported being in more poor health than as opposed to the cisgender.
Mm.
38% of transgender people experience a lifetime of depression versus 19%.
Yeah.
Now, here is the key thing I want people to pay attention to: health insurance coverage. A larger share of transgender than cisgender adults, 19% versus 12% respectively, report that they were uninsured
Mm-hmm.
over the 2017 and 18 period. Here's another factor for us trans folks. It goes just beyond if we even have health coverage. This is what also happens. Nearly 1 in 5, 19% transgender adults report experience barriers to care due to
Mm-hmm.
cost, more than share reported by cisgender adults. These are copays, monthly premiums, paying
Yeah.
for our medicine. Personal doctors, a similar share of transgender, 22%, and cisgender, 21% adults report they do not have a personal doctor or healthcare provider.
Mm-hmm.
Time since last checkup. A similar share of transgender and cisgender adults report having gone more than 1 year since their last checkup.
Mm-hmm.
25% versus 24%, respectively. I'm
Yeah.
going to just sink in and just let everybody sink in on these facts.
Mm-hmm.
They did not have their coverage, and there's still more. We don't have the updated stats yet, but
Yeah.
that's the reality, people. We're having challenges. But I'm gonna go ahead and
Yeah.
exit this slide here real fast. But I'll let you comment on this, Tsukuru.
Yeah. So while I was, while we were looking through the stats, what was going through my mind was the fact that so a lot of issues are interrelated, right? Um, so the thing about education, I mean, there are a lot of factors that prevent transgender people to get higher education. One thing definitely is discrimination, bullying that we face at school, in schools, uh, making it hard for us to continue seeking education. And also a lot of transgender youth uh, have difficulty at home. Some are kicked out of their home. So when you're in that situation, it's very difficult or nearly impossible, if not impossible, to continue education. So that's why. So I think we have a very difficult start. Transgender youth have a very difficult start in life. Anyways, so that's kind of like a causes chain reaction, like in their later life too. Because if you do not have a higher education, most likely you are going to get a job with a lower income potential, you know. And then on top of that, discrimination at your workplace, as we discussed before, make it very, very difficult to, for you to hold down a job, or experience stability in your employment situation. And that translates into not having healthcare coverage because in this country, unfortunately, healthcare is tied to your employment. So if you do not have a stable uh, career or stable jobs, you do not have healthcare coverage, So it's kind of a chain reaction of a lot of, different issues and different factors. Um, I don't know.
That
It's yeah.
that's why I was pissed about the whole thing with CalCare. Like, I mean, oh my god, it's like, do you realize like California is like it's such a privileged state on so many
Lot of
levels.
billionaires here. Lot of
Yep.
billionaires. Yeah.
Silicon Valley, like it's all here. Okay,
Mm,
and I want to make a note too, like when it comes to like being able to kind of balance ourselves. Like, okay, people talk about like minimum wage too. I kind of want to talk on about this a little bit.
mm,
Yeah, okay, because it has to do with the income bracket, right? Like, okay, like I know like a few people who make about, I want to say average about 30 bucks an hour. So like they're in a pretty good income bracket, but they cannot actually really afford to actually be here though.
yep. Right. Mm,
Like the rent is ridiculous. Like I know out here in Sacramento, like they've been raising the rent like, it feels like every year since I've been out here.
mm, mm,
And part of the reason is because you got people that are living in the Bay Area. And if you think Sacramento is bad, the Bay Area is just as bad. It's
yep.
worse, actually.
Mm,
Seriously, over $3,000 a month for a studio apartment. Like, you got me messed up, first of all. But,
yeah.
like, all jokes aside, I mean, that's the point that we're trying to make. Like, like for my story actually a little bit, I can't even get approved for Medi-Cal. I cannot get approved for Medi-Cal.
Mm,
Like even like I show them like, hey, like this is what I'm paying, this is how much I make. However, this is where my money is going, like towards rent and everything. Still don't qualify for Medi-Cal.
mm, right.
I can't
Because
get
you
approved
make
for
too much,
SNAP.
right? So
Mm-hmm.
yeah, here's the thing. Yeah, that's the thing though. So like canvassing out there in Washington State, you know what kills me? Uh, one of the responses that I got is like some people truly believe that um everyone has healthcare. So yeah, okay. Here's the response that I got. Oh, but you know, if you're poor, you're covered. Okay, if you're very poor, yes. But there are people like you, and probably this summer, I'm guessing I'll lose medical too because the federal subsidy is over, right? So they are actually moving towards cutting off people. And when that moment comes, I will most likely to be disqualified because I make slightly too much for, too much to qualify for medical, but I don't make enough money to afford private insurance in their marketplace, right?
Mm-hmm.
The covered California marketplace, because um, even though it's a affordable care, it's hundreds of dollars monthly. I can't afford that, right? So there'll be people, and already there are people like you, Noah, who fall through the cracks, not poor enough to be covered by the state plan, but do not make enough money to afford private insurance. So yeah. So that's the thing, though. People don't get that. You know, people do think that, oh, but if you're poor, okay. But here's the reality, though. So last I heard, in LA, the average rent is $3,500, right? $3,500.
And I bet it probably doesn't look like it's worth $3,500.
No, no. And here's the thing. So I believe in order to qualify for medical, and don't quote me on this because I'm kind of iffy in my memory, but I think it's like less than if you make something like $1,300 a month, I think
Mm-hmm.
you are or more than that, you are disqualified. Okay, so there is like a very what should I say? It's like an inconsistency, or there's a gap in reality here, right? Clearly, because if you make, say, like $1,500, you most likely cannot afford rent. Okay,
I,
so you are living with like, okay, two, three other people, right? So that's like
mm-hmm.
how you afford to live here. However, you have little money left to do anything else. And most important
Exactly.
right? Most important thing is like for you to eat or for your family to eat, because if you don't eat, you die, right? So food, you pay for food and that's it. Okay, you do not have money for health insurance, but then the state tells you, well, you make too much money. There's a gap.
Our system sucks, but actually, I found what you're looking for. Actually, Tsukuru. I actually have the eligible, like the qualifications for Medi-Cal. So here you go. So for me, yeah, I actually would technically would be the family size of 3. So I believe it's like 31,782 a year. I make a little bit more than that right now, just because I had to take a significant pay decrease.
See, it's nothing though. Okay, come on, like tell me again. It's nothing because it's you're talking about annual income, right?
Yeah,
So
that's
it's
annually.
nothing. Let's just hold on. Where's my calculator? Okay, tell me again.
So I technically, okay, so the family size. So I have 3 people that are here.
Right.
So basically, I have to make $31,782 a year to qualify for Medi-Cal.
Yeah. You have to make less than that, right?
Yeah.
That's yeah. Okay. So here it goes. So it's like $2,648 a month. Come on, people. How do you live on that? How do you live on that in California?
I
Come
mean,
on.
okay. I'll just be real. So what I pay here is over 2,700 a month here where I'm at. I mean, it's been a challenge. It's been hard.
Yeah. Yeah.
Just being able to provide food for my family, because I mean, this month I've kind of got a little bit of a break because I basically paid more when I initially moved in, so I had July covered. But like the rent's coming up right here, and I'll make a PSA. I recently been recovering from COVID,
Hmm.
so now I'm going to be taking a big pay cut this time around. I'm probably not going to be able to afford to pay this month's rent.
See.
It's difficult. Like I've been encouraging a lot of trans people, actually, for those who don't have healthcare. Like I know it sucks, but like even the ones that, like, if they're able to do it, like I've been utilizing like a third party service when it comes to
Hmm.
getting my hormones.
Yeah, a lot of us do, right? Yeah.
Hmm.
You know.
It sucks. $89 a month. That's what
Yeah.
I pay. But
Shouldn't have to pay for it, but yeah, I know it's kind of affordable option, right? Yeah, affordable and doable option, because where else do you get it? I mean, really. So yeah,
yeah, I
yeah.
mean, I just think about the thing that really bothers me though is like with trans youth, they don't even have like third party services for trans youth. I mean, I'm blessed right now, like with my kid, like her blocker is like for 6 months. So like she's
Mm,
okay. But
mm,
like with her hormones, that's the thing that worries me. Like
mm,
she's okay right now. But it's like, who is she gonna see? And the thing is, like, even with employer based healthcare, they kind of like don't even give you a lot of options. Like, I mean, with my job, like, I got to go back to Kaiser. And I'm sorry, I had a really shit experience with Kaiser when it came to my kid.
mm,
Like, I don't even trust them. That is a barrier that most trans people face when it comes to healthcare in general. I mean, the affordability in itself, or quote unquote, I should say, I mean, that really says it all when it comes to like when you think of healthcare.
mm,
We're not seen as human beings. We're just walking price tags. They don't give a fuck about our health at all. As long as they're getting their dollar and they're getting their cake and they're eating it too, that's all that fucking matters to these people.
mm. And okay, so I want to point out one thing. So the reason why I think we should demand to be included in the conversation when it comes to healthcare justice and we should demand seat at the table. I mean, that is to say, proactively get involved. Why is because we face a lot of discrimination at the point of care. So it's almost okay. So I don't want to say it's not enough, because okay, so if we can get care, great, okay, great. That's the first step, right? But it's not enough. There is a cultural um sensitivity. I forgot the word that Kaukia uses, but there's that cultural piece that we deserve. And this is not really actually only trans folks, but like immigrants, or ethnic groups or racial groups. Like, we all have this cultural piece that have to be respected, because we all have the right to get care, and while feeling secure, feeling safe, and feeling respected as a human being, right? So, what Kaucare, the beautiful thing, the beautiful thing about Kaucare was that the cultural piece was included. There was a budget for medical professionals to be trained in the cultural piece that was incorporated in Kaucare, you know, and that's actually not often, that aspect is often overlooked. So that's why, though, and observing the healthcare justice movement once again, and I have to emphasize it's not only trans folks, it's transgender people, LGBTQIA plus, and like racial groups like Asian, blacks, Latino, immigrants. We are often not part of the conversation for a lot of reasons, because first of all, a lot of us distrust um, mainstream activism, community, because we have a history of being neglected and kind of shunned, right? So a lot of people don't want to actually participate, but we really do have to participate, because again, we need to be included in the conversation. We have to shape the conversation. Okay, so that's why, because if we don't, uh, they will not see the need, to have this cultural sensitivity. Um, yeah. Anyway, so yeah.
Well, that's why mental health, they actually have changed it now to cultural humility.
Mhm.
We all need to have a dose of humility these days. I mean, there's a lot of like people who engage with Karen entitlement syndrome. And honestly, it needs to fucking stop. Like, seriously, like, you need to sit back. You need to let people in. If you're touting around saying that you are for, like, I'm actually going to address with my own race. It's like, I see a lot of us engage and say, like, hey, we're for Black Lives Matter. We're for stopping Asian hate. Okay. What the fuck are you doing? You're sitting there also shutting these same minorities out as well when you're touting that message. If you are a significant ally to other minorities, sit back, shut the fuck up, get educated, listen to their points of view. Simple as that. I do not care if I get shit for it. But it has to be said. It has to be said. Like, we really need to just, all of us need to sit back and shut the fuck up and listen to one another. Because if you find, yes, we're going to have differences, but I mean, we do share similarities.
Mhm.
We're
Yep.
unique. We're not a fucking category. Okay? Don't like overstep the boundaries and act like you are going to fucking be the voice of everything. We need
Mhm.
to be included in the conversation.
Yep.
If you are one of these people that are for trans rights, fuck, invite one of us to the table and talk.
Yep.
Don't kick us out of the table. Don't act like you're all big and bad and think that you know everything. No, you don't. talk to each trans person.
Mm-hmm.
I know that's like going to be kind of like an impossible task, but I mean, well, not entirely. We got social media now, but still, talk to us, listen to us. Like we're struggling.
Mm-hmm. Yeah. So on that note, though, I just want to share something, a story, and it's not only story. What should I say? Actually, this is a plea that I'm making, because I got to know this person, um, fellow transgender man, because I have another show on another network, Project True, which is kind of, I'm taking a break from that right now, but because I have to regroup. But anyhow, so he was on my show months ago. His name is Craig Sheffer. He lives in Truckee, California, which is, my understanding is kind of towards Salt Lake City, I guess. It's kind of like, yeah,
It's kind of
up
near
there.
like that entrance with like Nevada. Nevada's next to
Right.
us.
Yeah, yeah, exactly. So, okay, so Truckee, California. He moved there in October of 2020, sorry, 21. Yeah,
Mm-hmm.
21, 2021. Uh, he is actually from San Francisco Bay Area, though. He is from the Bay Area originally. Uh, was in Florida for some time. Um, and his story is he was a visual merchandiser, for retail companies. He had a career, but at age 35, he was injured at work, which unfortunately made him disabled, and he had to move out of his career because he couldn't continue. So anyway, he was in Florida for some years. He While he was in Florida, he was looking for artist community where he could spend his I guess old age, right? I mean, we're kind of old age. He's like my age, 51. So
Mm-hmm.
yeah, so he moved to. He was luckily he was accepted. His application was accepted to the artist community program in Truckee, California. So that's how and why he moved there. His story goes, because he's disabled, he is supposedly covered by state program. And then so when he moved, after he moved to Truckee, California, it took him like 4 months though to get his first appointment with his primary doctor. 4 months. So February 2022, he got first appointment with his primary care doctor. Um, After 2 weeks of his first appointment with his primary care doctor, uh, his doctor dropped him. Yeah,
See,
two
I'm not
weeks.
even surprised about that. Not
Yeah,
surprised, but go on.
and he suspects the reason why was because he's a transgender person. His doctor did not have any experience with transgender people, and even though I guess in his first appointment, his doctor said, well, he will make an effort to learn about transgender people's needs. Um, he dropped him, and actually, well, either his doctor or his the hospital, care system that he is under, told him to go to Salt Lake City because he will get better transgender care there. But he has a transportation difficulty. He does not have a reliable means of transportation, so it's impossible for him to do so. And I mean, he shouldn't have to do that when he lives like 1 mile from this hospital system, right? So
Mm-hmm.
anyway, after his doctor dropped him, I think what needed to happen was his hospital care system to assign him to another doctor, right? Naturally, but
Mm-hmm.
for some reason they have not done that. They did not assign him to another doctor, and therefore he lost his access to medications and hormone, of course. And yeah, so and Craig has a lot of issues, medical issues, including, okay, so I have to get this straight because I can't pronounce this word, but hold on, I'm gonna try. So polycythemia, uh, polycythemia. So it's a
Mm-hmm.
type of blood cancer. That's, yeah, in short. He has a type of blood cancer and skin cancer, right? He needs his medication. He needs his medication, but they're not treating him right now. And in his words, he's just waiting to die. Okay, this is serious. Yeah, he has condition because of his blood cancer. He has conditions where you know uh, he's susceptible to develop blood clots, which is very dangerous. I mean, as a trans man, though, I mean, taking testosterone already, makes us susceptible to blood clots. So um, anyway, so he's been self-advocating. It's not like he has been, sitting on his hands, like waiting for some kind of savior to come. Like Craig has done everything. He's reached out to many organizations, many politicians, and advocates, advocacy agencies, but he has not, to this day, he has not gotten uh, the help he needs. So I am actually, you know, uh, trying to set up petition drive for him, targeting Governor Newsom, Governor of California, because Newsom talks about healthcare a lot. He's supposed to be a champion of this cause. And actually, I think if I remember correctly, a few weeks ago, he was celebrating the fact that California now has, provides access to healthcare to everyone. Kind of ironic, but anyway.
Mm-hmm.
So, yeah, I am starting a petition drive targeting Governor Newsom, asking him to step in on behalf of Craig, because we do not want to see another trans person to lose their life, right?
Yep. And
So
oh, go ahead.
go ahead, go ahead.
Well, I was gonna say it also kind of brings up that accountability factor too, calling that shit out. Like we're supposed to be a state that's LGBTQIA plus friendly. Okay, then fucking prove it. Answer to that shit. Like
Yeah,
honestly, like when you were talking about that, like it kind of hit home for me. Like the whole concept, like I'm just ready to die. Like nobody should ever fucking have to even say those words out of their mouth, period. Trans, cis, doesn't matter. Those words shouldn't be even leaving anybody's mouth.
I know.
But like JT had said, they actually live in Texas. Like that's worse than California, okay? Like, I mean, that's a separate discussion topic. But
Hmm.
nobody is educated. And honestly, I'm not even surprised when you're saying like the potential reason for him being dropped is because he's trans. That area, like above Sacramento, like I would say anywhere in Placer County, like it's all red.
Hmm.
Like so that's
Hmm.
why like I wouldn't be surprised if that was the reason.
Yeah, yeah.
I mean, and you're right, like that's the procedure though, right? It's like, okay, well, if you like you are supposed to get referred out to another provider regardless. It's
Mhm.
even like that in counseling. But see,
Yeah.
here's the thing in our ethics. I'm not sure about the medical ethics, but I know in mental health ethics, one of our key things that requires us to be like really effective counselors and providers is remaining competent about issues. Okay. It is in our ethical codes.
Mm-hmm.
Seriously. I mean, it's not our job to educate you. Like, I mean, we could definitely like give you our insights. But like again, humble yourselves. And I'm all for that. Like that's the. Are you doing like a GoFundMe for him? You said a petition for him,
Petition,
right?
petition. Yeah. My thinking behind this, folks, is that okay. So far, as I said, yeah, I mean, Craig has reached out to everyone. I mean, what he's done under the circumstances is remarkable. I don't think many people can self-advocate like that. But unfortunately, his self-advocacy has not gotten him what he wanted, right? Till this day. And I really want you to get this. He is literally dying. And as I said, I personally don't want to see fellow trans man to die, okay? I mean, knowing him, I mean, if we let this happen, no, 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 no. We can't have this, we can't have this. So, okay. I kind of lost the train of my thought, but here's my thinking. Okay, so, um, petitioning Governor Newsom, I often, have heard people say that, oh, petitions do not do anything. Well, maybe so, but if we get this issue talked about enough, if we increase the visibility of this issue, and Governor Newsom, I think he's like, going for presidency. I think his ambition is to run for the president of the United States, right?
That's the
Okay,
last thing we need.
well, for Newsom to let this trans guy die during his governorship of California, that's not the legacy that he wants. Okay, so let's get this talked about. Let's increase the
Exactly.
visibility of this issue, the story of Craig Sheffer, so that he doesn't have to die, people, okay? Let's get his health care. Let's get him health care because he deserves this. He's under the state system already. And it's just outrageous that he is not getting the health care he needs, you know? So I mean, okay, this is the passage of like uh the sentence that he wrote to me. He says, I moved here, meaning Truckee, California. I moved here to plan my life at 51, not my death. That that broke my heart. That still breaks my heart. Okay, we can't let this happen.
And I'm just gonna say this: if they don't do anything, and Craig dies, that in itself is a hate crime.
It is
Like,
a
I'm
hate
just
crime.
being real. That I know we did say that we were going to talk about hate crimes. The fact that the government is like literally allowing all of us to die because they really want to get a buck while they are sitting there having all the free health care to themselves, by the way.
Yep, yep.
I mean, literally, they work like what, like a couple times a year, and that's it. They get this nice salary, they're covered. Meanwhile, there's many of us here in America that don't have health care and we're dying literally.
Mm,
I'm
yeah,
for this petition. We need to call this shit out. Like, seriously. Like, again, like to your point, politicians, I say that they're walking advertisements. They definitely would not be happy if we got in their faces. But that's the point, though, right? We need to make them uncomfortable. They've been in comfort too fucking much. We need to be in their faces and say, hey, look, we elected you guys. You work for us. There
yeah.
are many of us out here that are dying.
Mm, Yep.
If you really are for the trans lives, then prove it.
Yep.
Prove it.
And you're right, Noah. It's institutionalized hate crime. That's what it is.
Mm-hmm.
You know, do not make it okay. Do not make it okay. Don't yeah. It's I feel like personally, I feel like I've been agonized over this. I feel like if we let this happen, we are just like making it okay
Mm-hmm.
for the government to kill us, and I can't let that happen.
And just for a PSA, I know there's a lot of people out there that are still gonna say that blue is actually gonna do well. Well, those are the people that are actually comfortable and have health care. So honestly, I don't take them seriously. Continue to spread awareness about the many Americans that are uninsured right now.
And also, okay. So here's another thing. While I was like canvassing, getting signatures for Washington State uh, healthcare initiative, socialized medicine. Okay,
Oh
people
my
hate that
god.
word. Right? Some people. I have no problem, but some people hate that word because they think it's communism, right? So socialized medicine. Okay, Here's the thing. So as Noah said, politicians, elected officials get nice health care. It's not like, I mean, I still think socialized medicine is actually a misnomer, okay? I don't think we should call it that. But, I mean, they get nice health care. It's not like socialized medicine. I don't
Yeah.
know. See? And also, like, okay, socialism, right? Socialism. Some people in this country hate socialism, but we give, I mean, not we, but the government gives subsidies to corporations all the fucking time. So I
Mm-hmm.
mean, there's a socialism for some, just not us, right? I mean, it's kind of like what our corporations get. That looks like socialism to me. They
That's
get
why
free
these
money.
people
They
that
get free money all the time. That's what I'm trying to say.
and these are the same people that are also touting around about how healthcare is a human right. Uh-huh. Yeah, that's why I'm not taking you fucking seriously. It's like even the whole concept, even with trans people, it's like you can't sit there. It's performative allyship. This is what I'm actually referring to. You cannot sit there and say that you are for trans people, but yet engage in a system where it's actually harming trans people. It
Right.
does not work that way. If you're a true, authentic ally, you need to go and join with us and be in these people's faces. I mean, again, the trans lives that may have been lost due to mental health in itself, that is never discussed.
Right.
And just think, like, all that shit could have been fucking prevented if you would have just been able to provide free health care.
Yeah.
I mean, if you take the bigotry to the aside, though, of course, at least they could have had some support.
Yeah.
That is the one way to be in an affirming and have an affirming environment. Okay, that is the key thing. Acceptance. This healthcare system, like, it's just garbage to me. Like, I saw a video. I definitely am going to talk about this video a lot, but like the Red Berets, that video that they posted on a thread, you had mentioned even our healthcare system is divided as well. Everything in this country is fucking divided. We need to get back to a point where it's like, look, we're human beings, okay? We're living, we're breathing, we're doing what we have to, but we have to have an understanding of basic fundamental rights. Being able to have health care, being able to go to the doctor, being able to live within our means, being able to have a decent wage, just everything. You don't have that. That person's not going to have a life, and they're going to be basically just another number in the system.
Yeah.
It's depressing. It's fucking depressing.
I know. And we have to remember we can change that.
Yes.
I may be naive to say this, but I firmly believe that we can change it. Because okay, let's face it. What's the alternative? I know it's fucking depressing, but then like we go through life being depressed and jaded, depressed, pissed off. Okay, I am pissed off sometimes. I am depressed sometimes. I am at the low point sometimes, and these days I guess that if I'm there, I am just there. I don't go out, but like I can't go through life like that, right? So
Mm-mm.
what's the alternative? So my alternative, the way I chose to be is like I just go out there and I fight. Because what's the alternative? We can change this. If
That's
we
what
if
I
we Yeah, go ahead.
I was about to say. That's why I always said hate. Use that hate and depression as a motivator to keep fighting. Don't wallow in your depression. You don't have to live in that way. Go out there and use your voice. I say this on all my TikTok videos. Do not let people ever fucking silence you. You are a human being. You have rights. You have fundamental rights. Speak your truth. Speak your voice.
Mm-hmm. Yeah.
Hold accountability when it's due.
Yep.
Because soon
And
enough, we're in a scary time too, where a lot
yeah.
of more trans lives are going to be lost.
Mm-hmm. Oh yeah. I hate to say this, but yeah, things can get worse before it gets better. But it
Mhm.
won't naturally get better. We have to work for it. Unfortunately, I wish it was like I wish I wish things get better naturally, but it won't. So,
It
but I
won't.
just have to say, Noah, thank you so much for bringing up Maricella's story today, and also like commenting, emphasizing the fact that she faced double, maybe triple um, stigma or difficulties because she was an immigrant. Uh, to this country, she was Latina, uh, and on top of it, she was transgender. So, um, because okay, so here is like what we face as an immigrant, right? So, out there when I was canvassing, um, luckily I wasn't physically attacked. I wasn't nobody like really. No, no, no. It was actually like on the back of my mind all the time because what's happening right now in the world. I mean, in this country, hate crime is against Asians, right? So it was like on the back of my mind. Like, okay, I hope I won't get attacked. I hope I won't get racial slurs thrown at me. Yeah, okay. These didn't happen, thank God, right? However, so one day I was canvassing, and
Hmm.
this woman, this white woman, asks me, "Where are you from?" So I say, I'm visiting from LA. I'm from LA."
Hmm.
She says, "You're not from LA. You have an accent." And I'm thinking, oh, here we go again.
Oh
Because
my
I get this
goodness.
a lot. I get that a lot. And actually not it's actually collective experience of an immigrant. I mean, if you're an immigrant, uh you get that a lot. So yeah. So she says, "Oh, you are not from LA. You cannot be from LA. You have an accent. Where are your people from, really?"
That's
And
all I got to say about that.
so yeah. So yeah, as an immigrant, you know, uh we are always like made to feel that you don't belong, right? You cannot belong here because you have an accent. You cannot possibly from here, you know, because you have an accent.
Hmm.
Yeah, it's expectation. It's like, well, you are going home someday, right? You are going back. you know, we get that a lot. So yeah. Anyway, so yeah, yeah. listening to you tell a story of Maricela really hit home for me. So
And trust me, we will definitely go more in depth with the trans lives that have been lost. But I definitely wanted to highlight her tonight because she's still not acknowledged on HRC's website, which, by the way, I'm waiting for you guys to put her on the website.
yeah.
I mean, like, literally, the fact that they didn't even want to put Sherry Bush on there. I mean, it was just insane because, like, what I noticed, it's a very class issue when it comes to trans lives. It's like, oh, okay, well, trans lives are going to matter if you're like a middle class person. Like, no, all trans lives matter. Doesn't matter which class that they're in.
Mm-hmm.
A life is a life, okay? That's all I'm really going to say about it. It doesn't matter what class they fall under. A life is a life.
Yeah.
We are human beings. And you know what? We deserve to have health care. We deserve to be able to live in a society. Like, you don't even have to like agree with us or even in a sense accept us, but at least like just tolerate it.
Yeah, okay, so that's the thing. So recently, a fellow Asian activist, like because we are in the same campaign together, advocating for justice for this Filipino family who got attacked by white supremacists. So, but I mean, what he said, I kind of laughed. I mean, we laughed together, but it's really like true. So he said, okay, well, we are not asking much. I know, we know some people really do not like us. Some people who are out there may not like Asian people, right? Fine, fine. So same, we can replace Asian with transgender, right? So yeah, okay, fine. Some people at the end of the day don't like us. You may not like transgender people. All we are asking is like, fine, but do not kill us, okay? I mean, that's not
Right.
much. That's not asking much. I don't think it's asking much. Okay. Yeah. Do not attack us. Do not harm us. Do not kill us. Like, let's just go. Maybe we'll just like live our life separately. But like, let's just have a peaceful life separately.
Oh my God, yes.
Not
I mean,
asking much.
it's not like we're out there killing them, are we? No.
No. Some people think we do, but no, 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 no.
No.
Some people think that we are erasing them, but no. Are we doing that? No. What
Well,
part of what we do makes them think that? We are just
well,
we're just trying to survive.
Well, I will tell you, I did get one of those lovely little comments again. They didn't actually call me a heterophobic person, but they were implying it. So I definitely pulled that card that you actually suggested. Oh, it's like, well, because basically what was going on. So, we did cover the gays against groomers.
Mm.
And so basically, I made a little post about it on TikTok. This guy comes on my thread and he's talking about, well, then fine, you guys need to stop teaching this shit in school and like with your agenda with trying to convert all these people. And I'm like, wait, what? And I pretty much said, okay, because he pretty much said at the end, we need to let kids decide for themselves. Okay, if you are going to say that, then fine. Then don't dictate them that they need to be cis and straight.
No.
Because that's pretty much what they're doing at the end of the day. And I mean, to go back to healthcare, though, I mean, with trans youth, I mean, it is hard for them.
Yeah.
I mean, it's going to get much harder for them. I mean, legislation, there's plenty of I think it was like what, almost 400 like anti-trans
Yep.
bills that are out
Yep.
there.
Mm.
A lot of it, yes, like it's kind of like a split in a sense. Some of it is trans sports, like trans people going into sports, but the other part is healthcare.
Yeah. Yep.
It's
Denying
gender
care.
affirming healthcare.
Mm-hmm.
The fact that they're in a sense trying to erase us, because that's exactly what it is in a sense. Like they're trying to erase us. They're trying to prevent us from living ourselves authentically.
Right.
We need to do better. Like, I mean, yes, we can understand that there is a fascist party out there too, but you can't go sit there and like offer like no suggestions to actually help the situation. You need the solution is we need to be in their face. Plain and simple. Call them out.
Yep.
I mean, call them out every day, but really go hard when it comes to election cycles because they will want to keep their seats. They don't want to give up that health care. They don't want to give up their privileges. Be in their face. Hold them accountable. If they are out there saying like, hey, you know, trans rights are human rights, and yet they're fucking supporting a system that's damaging to trans people, call it out.
Well, being silent about it. Yeah, I mean, yeah, you know, if I remember correctly, our current president, I mean, you know, he is a supporter of trans rights, right? I mean, he ran on that practically. So we should hold him accountable, you know, his administration accountable, because that was his promise. You know, he ran on that. That was like one of his big thing, you know, on his campaign.
I mean, the only thing I will give him this is that he was able to lift that ban with trans people in the military. That is one thing I can give him credit for. However, do I still think he's a shit president? Fuck yeah, because he's still allowing all this shit to happen in a sense. He ran on that shit. He basically, the problem that I have with performative art, they do a lot of speaking platitudes. Yep. Anytime there was an attack with the trans community, he would sit there and have this platform of speaking saying, oh, well, I stand with everybody in the transgender community and we'll continue to fight for you. Okay, what the fuck are you going to do? Show me a plan.
You know what they say, right? I mean, and I'm talking about Democrats. Okay, so with, you know, anti-trans bills, you know, abortion, anti-abortion, with both of these issues, they always say, oh, but Republicans are not letting us do our thing, right? I mean, oh, come on.
Who controls the House? Who controls the Senate?
Right?
Who controls the presidency? Yes. I didn't realize the Republicans controlled all that shit. But it's, you know what?
Republicans are not letting us do our, you know, fulfill our responsibilities. We want to do it, but Republicans are interfering. Really?
Republicans are just reinforcing the hate. That's what they're doing. Right. They're reinforcing the hate and the bigotry.
It kills me though, because it's like, oh yeah, so next election cycle, we need to win. Give us more money so that we can defend abortion, so that we can defend trans rights.
HRC did the same shit to me. HRC, they will send me text messages and they say, hey, like you know, Roe v. Wade is on the line. Please donate to us so that way we could support more politicians so they could fight for us. No, until I actually see actual action, like you're actually getting in people's faces, I'm sorry, you're not getting a dime out of me. Like, you can go do something with yourself.
Right.
Like, yeah, I'm not going to support performative speaking.
No. I mean, okay, so who said that? You know, like, because it's like right now, they want money from us. And then they are saying, okay, if you give us money, we'll do something for you, right? Well, what about you do something and then we'll give you money as a reward? You know, it's like it should work that way, you know, because that's how it works, like in a regular job, right? We do something and we get bonus, right? Well, sometimes, but I mean, what I'm trying to say though, like, I mean, that's kind of fucked up. Like, you ask us for money, and then we give you money, but you do nothing. I mean, where did our money
Exactly.
go? You know?
It's a bait. That's all it is. It's bait.
Yeah.
That's all it is. Like people, y'all. I mean, if you guys haven't seen this shit, then now that all this is going on, then honestly, I'm gonna feel really sorry for you. And I'm just gonna only assume it's probably because you're very comfortable in healthcare, or more or less, the whole Trump narrative has scared you so much. Okay, like I mean, I can go on a whole different rant about this with Democrats.
Fine.
I mean, but to your point though about saying that it's all Republicans' fault, okay, no, it's your fault too as well. Accountability does not go to one specific privilege. It applies to everyone. That includes yourself. Okay? I think actually, honestly, the whole thing with Roe v. Wade, I'm just going to say this right now. I think it has opened up quite a few eyes, like just to be real, just because it's been overturned. And people are starting to see kind of right through this bullshit that Democrats are doing.
Mm-hmm. Yep.
It's like, you need to be doing more for us. Like, now we're going into a time now, like, honestly, like, I just want to say, even just, it goes beyond with trans people, but even with women, like, I'm scared for them right now,
Oh
too.
yeah. Oh yeah. Mm-hmm.
All of them. Like, their rights have been pretty much, like, stripped away.
Yep.
Like, I mean, I heard about the story with the 10-year-old girl that was raped, and they would not allow her to get an abortion.
Yeah.
Christo-fascist, I swear, that's what we But I mean, the point of the story is that we need to be out there. We need to be using our voices.
Yep.
We need to demand better for people that are going to be representing us. Withhold your money. Do not donate to any party until you actually see that they're doing something for you. Ignore the crumbs. Okay?
Mm-hmm.
Like, this is why, like, the protections that are out there right now, like, that's why I'm, like, kind of not, like, celebrating over them. You know what I mean? Because
Mm-hmm.
at the end of the day, it's just going to be overturned again. I mean, this is basically what our political system is. It's basically, okay, well, we got some comfort for now, but we're really not going to do anything. But then, like, you have a fucking mean party that comes in. I'm using quote unquote the mean party come in,
Mm-hmm.
and, you know, they reverse it all. So it's basically just a cat and mouse game.
Mm-hmm. Mm-hmm.
It's not stable.
Yep. And you know what? I feel that trans people, we are being used by
Mm-hmm.
both parties, right? Because Republican, okay, and sorry, okay, now let me just rephrase this because I'm not one of these people that all Republicans are bad. And I'm not okay. So just let's be clear that I believe when it comes to politics or politicians, you need to be issue based. Okay, so it's not actually a matter of Republicans versus Democrats because they are equally bad. Okay,
Mm-hmm.
so let's establish that first. But having said that, uh, so these haters who are out there, passing anti-trans legislations or proposing, introducing them, okay, they're doing that because we are vulnerable population, because there are people out there who want to erase us and attack us, and we are easy target. Okay, so they are doing this to earn brownie points, right? On the other hand, Democrats use our issues to get donations or to earn advantage over Republicans, because then like they have excuse to look, make Republicans look bad. So we are being used, by both parties.
Mhm. That's kind of what I was referring to. It's one of the qualities of performative allyship. You know what I'm saying? Like they're putting us front and center, and they're also not truly educating themselves or others properly in a sense, and they're inviting more hate to come towards us.
Right.
They use us as pawns.
Yep. Exactly.
That's essentially what it is at the end of the day.
Mm-hmm.
Like that's why I don't take that anybody seriously anymore. Is because if you're gonna go sit there and I see it with other members of the LGBTQIA plus too when they advocate on us on our behalf to like politicians. It's like really you're gonna like participate in inviting all this stuff in. I think I remember a while back ago. I think it was oh god, I cannot remember his name. I can't pronounce his last name, but he's from the Humanist Report.
Oh, yeah, 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 yeah.
Mike. I know there was a tweet a while back, like he was attacking a Republican, but like he was in a sense engaging in that tactic that we were just referring to, using us as pawns to attack another Republican. And man, oh man, if you saw the comments, like it scared the crap out of me.
I have to look that up. I mean, I'm kind of scared too, but I have to look that up.
I'm gonna have to find it honestly. It was on my old Twitter account, but I'm sure it probably wouldn't be too hard to find, honestly. So, I mean, unless he blocked you, which he has not had me blocked. So, fingers crossed on that. So, but I know we've been kind of over time actually. But like, just a little closing message though. I just want to say though, you are all human beings. Please use your voice. Please do not be afraid. Again, I will keep reinforcing this. Do not be afraid to engage in uncomfortable conversations. Be in these people in power's face. Be in your senator's face. Don't write letters. Be in their face. You could definitely write letters, but I mean, I don't really know like what the effectiveness of that is, to be honest. But like, roar. Hear yourselves roar. Let them hear you roar. Oh my god, that's such a tongue twisting phrase.
Yeah.
But please, like you are all individual, you're human beings. You deserve to have health care. You deserve to live your life without experiencing bullshit.
Mm-hmm. Yep.
Don't engage in a competition game. Don't say like, oh, like don't make this like who's more important than who. Leave the entitlement at the fucking door. That's not important. People are losing their lives every day. Our system is slowly going, well, actually, it's more escalated now. It's going in the tank. Climate change, it's definitely destroying our planet. We really need to get on this, people. Humble yourselves. Take the opportunity to listen to someone. And I also kind of want to reiterate something, too. We are not a network that's going to claim that we're the voices of the trans community at all. We are a network, again, that are trying to platform more trans voices and LGBTQIA plus voices. So I just wanted to go ahead and put that out there. Did you have any last closing remarks, Tsukuru, before we close?
Just one practical one. So as I said, I am introducing this petition on most likely on change.org in a few days, if not tomorrow. So when this video ends up on a YouTube channel, it'll be in the link will be in the description, and I'll be introducing it on Twitter, Facebook, any platform that I can, introduce this on. So please look for it and please support, because this guy waiting to die, it's one of us. He's one of us, and also we can be in his position.
Hmm.
Okay, so let's support him and let's get him healthcare that he needs. So
Totally agree. Once that comes out, I will make sure I share the shit out of it.
great, thank you.
Definitely put it on my TikTok. I mean, again, just to kind of echo what you said, Suguru, just please share it once it is released. I mean, it is one of our own. If you are definitely an ally to the trans community, please make sure you share the shit out of it.
Yep,
We
thank
don't
you.
want to lose another one of us. Like, we need to be strong and united. They're trying. The system is trying to kill us off. We must not let them kill us off.
Right.
We must keep fighting against it.
Mm-hmm.
Okay, that's
Yep.
essentially what this is. And by the
Yep.
way, JT said that they will share it too. So yeah,
Thank you, JT. Yeah,
please,
we
yes.
need you. We need every and each one of you. And we doing this together is actually really a testament that yes, we can, change things for the better. We can have the world that we want. So,
And even though it may seem very dark and you may be pessimistic about it, but honestly, we all live once. You know what I'm saying? You need to go out there and actually fight for what you believe in. If you believe that you need free healthcare, go out there and do it.
yeah.
Scream it out loud. Don't focus on the misery,
Mm,
because honestly, that's going to be the barrier of getting anything done effectively. Is if we constantly wallow around how bad it is. No, we need to go out there and actually fight for it. Of course, let's plan, let's strategize, let's do what we need to do.
yeah.
But let's not continue to wallow in depression. Because as long as we do that, we're basically giving our lives to them on a silver platter.
Mm,
That's not necessary. And as like JT said, we need to help each other as much as we can,
yep.
particularly with my trans siblings.
Mm-hmm.
Please, enough with gatekeeping. Let's help each other out.
Yep.
Any trans lives, of course, if you need to screen them carefully, screen them. But let's let's practice mutual aid with us, please.
Mm-hmm.
There's many of my trans siblings that I have seen even on Facebook before I actually left Facebook. Some of them were asking money for surgeries, getting on their hormones. Help them achieve that. Because when trans people do not get the opportunity to live their authentic selves, it's just mental hell and misery.
Yeah.
Even on my worst enemies, I would never wish that on anyone. It's torturous.
Mm-hmm.
Help a fellow trans person today. Help a homeless person today. Please. This world is missing empathy and compassion. Please model that. Whether if you actually, that would be a challenge I would actually impose on everyone. Take one day of the week and show an act of kindness. Because right now, there's a lot of people out there that are giving up hope.
Mm-hmm.
I mean, people don't really talk about this, but I mean, suicide rates are going up. And you know what? You wonder why. We got people out there that are sitting there reinforcing that we need to be sad and we just need to be miserable. No, we need to do better.
Yep.
Cry what we have to cry out. But let's organize. Let's get together.
Mm-hmm.
Let's achieve trans rights. Let's achieve healthcare rights.
Yep.
Let's do it all.
Yes.
Let's do it
Yes.
all.
Yep.
Do not, and lastly, as a PSA, do not donate any money to any politicians until they actually demonstrate that they're really going to say, like, they're actually going to do shit for you. They're not speaking platitudes. You actually see the action. Do not donate to any political party, because you know what? It's a bait, it's a
Mm.
trap. Do not
And
do it.
okay, so I would like to say this. So if you see a candidate that you believe in, support them, because we really need to vote out incumbents because
Yes.
they're not doing anything for us. And don't be that person who says, "Oh, if you vote for third party, you are throwing away your votes,"
Oh
because
my
that kind of thinking really does not get us anywhere. That's why we never, we haven't been able to establish a strong third party. Because if we continue saying that, it's like a self-fulfilling prophecy, right? Because
God.
oh yeah, we are throwing away our votes if we vote for a third party. But if we believe that, and if we keep voting for these two parties, I mean, how can we, build a strong third party? So let's not fall into that. I hear that too often. So I just
Oh,
wanted to.
and I would not support Andrew Yang's third party, by the way. I'm just gonna put that out there. Like, I
Right,
mean,
right.
okay, like I will truly never forgive Andrew Yang for what he said about the mentally ill. I will never forgive
Right.
that.
Mm.
And just so people like understand, he basically reinforced the mental health stigma and said that basically all mentally ill people need to be criminalized. And he's pro-Israel too. So
Yeah, I mean, screen them carefully, of course.
yeah, screen them carefully,
Yeah,
but
yeah,
like, I
yeah.
mean, seriously, fight for them. Like, if there are genuine people out there that are willing to, like, or that are not afraid to be in people's faces, then vote for them.
Mm. Yep.
Don't vote for people who are say that they're going to be in their face, but then they kind of just get complicit and actually fall within that system and get pretty much like forget their own values.
Mm-hmm. Mm-hmm.
Please never forget your values. That is the one thing I want to emphasize too as well. That is the thing that's been going on. A lot of people have forgotten their values and their morals because it's been taken away by greed
Right.
and
Right.
power.
Yep.
So please continue to like, subscribe, share the channel. We are going to be converting to audio shortly on Anchor. So I look forward to having people listen that way as well. And we will see you all next Tuesday.
Yes.
So much love to you all. Please stay safe. Okay.
Thank you so much, guys. Love you all.
Love y'all.